this from the recent estimates, not so recent, 2016. It was estimated that there were about 171 million people in the world with diabetes. And by 2030, that would increase up to 366 million. According to literature, we've already moved further, like within 10 years, it seems like we've even exceeded the projection. So in Uganda, let's come back home. What's happening in Uganda? In Uganda, we have the overall prevalence of diabetes at 10.1, but 3.8 are the percentage that know about their diabetic situation. Either they are already on treatment or they tested somewhere and they were told they were diabetic. So the 6.3% have no idea. So this was found out in a study in 2016 where people were tested and that percentage of people, 6.3, had no idea they had diabetes. So meaning us creating awareness is a very big cause we are doing. Because if we can get all the 6.3 to know about it in time, then we prevent the complications I've just mentioned about. So what causes diabetes? So we talked about prediabetes, type 1, type 2, then gestational diabetes. So we will start with diabetes 2. So diabetes type 2 is caused by a combination of genetics and our lifestyle. Okay? Genetics just means you have no say. You are born with a predisposition to get diabetes. Then lifestyle, what is that about? That's what you're working on right now. Everyone who went cycling, you're trying to get your health better or avoiding the lifestyle risk factors. So being overweight is one of the risk factors for getting type 2 diabetes. And we are talking about belly fat mostly, the fat around the trunk and the belly. So if you have a big belly, you need to work on that. Otherwise, it's a risk factor. Somebody's giving me an eye. Like, are you talking about me? But yeah, that's how it is. So fat cells don't respond to insulin. So if you have a lot of fat cells, that means you're driving in a dangerous road. So the condition runs in family as well. But if you have a family history and then you're overweight, then you have two risks. So at least if you know about the risk of family history, but take care of the other risk, which is being overweight, then you have one down. So you reduce the risk of getting type 2 diabetes. Let's move on. Type 1, unfortunately, the cause is not known. For some reason, your immune system attacks the pancreas and destroys those cells that produce insulin. This may be associated to a viral infection. I know these days you hear about, you go to the clinic, you're not well, they tell you have a bacterial infection, you have a viral infection. It's become a common thing. But unfortunately, sometimes when we get a viral infection, it triggers an immune response that attacks the pancreas. So that way you may get type 1 diabetes. So this one also has some family predisposition. In other words, genes play a role. Not everyone that gets a viral infection ends up with type 1 diabetes. Moving on. Gestational diabetes, on the other hand, has to do with the hormonal changes that happen in a pregnant woman. So the placenta, which is part of what feeds the baby, produces some hormones that make the body of the mother less sensitive to insulin. But again, being overweight is coming in. If the mother has gained too much weight during pregnancy, that's a risk factor. Okay? So that's why I'm saying people who have gone cycling today are our biggest fans, because they are fighting the diabetes in a way. Because obesity or becoming overweight, yes, they deserve a clap. Being overweight is coming up again and again. So it's a big issue when we are trying to fight diabetes. So again, let me go over the predisposing factors, but in a condensed way. So we have being overweight as number one. Then if you're 45 and older, you're at risk of getting diabetes. If there is a history in your family of someone who is diabetic, you're at risk. If you're physically inactive, you're at risk of getting diabetes. If you've ever had diabetes while pregnant, you're at risk. If you've ever had high blood sugar while pregnant, you're at risk of having high blood sugar even when you're not pregnant. So any history of pre-diabetes, if you've tested sugar before and it was abnormal, but you were told, but you just need to do some changes, that means you're at risk and you need to actually work hard. So if you have high blood pressure, have high cholesterol, or you have polycystic ovarian syndrome, those conditions predispose you to diabetes. Some drugs also do. Drugs in the sense of medicine, not happy drugs. So steroids, I'm still on the other side. So steroids can put you at risk of getting diabetes. Steroids are like prednisolone, they are like dexamethasone. Dexamethasone on the street is called Dexa. When you have flu, they tell you take some Dexa. So that predisposes you to getting diabetes. The other drugs can be like antipsychotic drugs.
Can I ask about the Dexa?
Maybe we'll ask after the presentation, is that okay? Yeah. Moving on. What are the signs and symptoms of diabetes? First on that list is frequent urination. Frequent urination. If you're going to the toilet frequently, you have to wonder, am I having diabetes? So the other is excessive thirst. And this excessive thirst is not just thirst after cycling. The thirst will be there all the time. You're sleeping, you wake up, you need to take some water. You're seated, you're working, you need to take some water. All the time, you're thirsty. You can take a whole 5-liter jerry can and you're still thirsty. That kind of thirst can be a sign of diabetes. Unexplained weight loss is a sign as well. So you might have been overweight and all of a sudden you've lost weight. You're like, it must be stress, or it seems somehow God has answered me to lose weight fast without working out. That can be a sign of diabetes. Extreme hunger. So if you've noticed that you seem to be more hungry than before, every time you want to eat, that can be a sign of diabetes. Sudden vision changes. This can be a sign of diabetes. It presents like blurring. It's as if you can't see well what you need to focus on. Sometimes you may try to read something on your phone and it seems like the letters are small and you need to increase the font. That can be a sign of diabetes. Tingling or numbness in the feet, that can be a sign too. Feeling very tired, or having a very dry skin, having sores that don't heal, or recurrent infections. About the infections, the ladies may notice that they keep getting yeast infections. That can be a sign of diabetes, or urine infections. So what do we do? What do we do to not to become diabetic? So screening is important, and lifestyle adjustment. Screening just means testing for sugar once in a while. Every time you do your annual checkup, checking for diabetes should be one of them. And I'll give you a criteria of who needs to be checked for diabetes. Lifestyle adjustment. We need to be active. We've looked at the risk factors. So you need to have a lifestyle that doesn't promote gaining weight, a lifestyle that keeps you active. You actually need about 30 minutes every day minimum of physical exercise. So making that adjustment puts diabetes away. Then treatment. What happens if you found out your sugar is high? So still with that treatment, you still have to adjust your lifestyle. You have to be active. You have to eat more vegetables and fruits and have a low carbohydrate diet. And then on top of that, you need medication. So medication can be in form of tablets or it can be injections. If you're having type 1, most likely you're going to be put on insulin. If you're having type 2 or pre-diabetes, you're given oral tabs to take. So there is treatment. And when you get treatment in time, then you don't get the complications that we talked about the kidney problems, the eye problems, the nerve problems. You don't get those when you get treatment in time. So who should be screened? Who should be tested? The American Diabetes Association recommends screening for type 2 annually in everyone who is 45 years and above. But in patients, in people younger than 45, if you're younger than 45 but you have the risk factors, which we talked about, being overweight, having a family history, if you were tested before and your sugar was high, then you need to test every year, okay? That's if you're not already diagnosed to be diabetic. If you're already diabetic, the doctor will tell you how often to check. But if we are just screening, everyone who is above 45 years needs to be checked every year. And everyone who's below but has risk factors needs to be tested. Pregnant women. In Uganda, all pregnant women are screened for diabetes in the antenatal clinic. So I think that's, at least we've moved a mile there. But if you go to the clinic and you're being screened for antenatal tests and they've not included diabetes, you can tell the health worker that I'm one of the people that need to be screened for diabetes. All right, so in summary, diabetes is a global problem.
Yes, I think so.
And is projected to get worse. The biggest population or the biggest number of us don't know that we are diabetic, but we are. So that's where screening becomes very important. And this can be prevented by creating awareness, by screening, and lifestyle changes. Thank you so much.